Hi, in this video, I'm going to be talking about some breast cancer myths and realities. The first common myth is that breast cancer affects only white women. That's not the case. Breast cancer can affect people regardless of their race and ethnicity. Where did this myth come from? Well, I believe it's from public health campaigns that generally target mammography awareness and breast cancer awareness materials to white women. White women are shown on brochures and on billboards and in commercials. It's really important to know that regardless of your race or ethnicity, you should avail yourself of mammography, and if you have changes in your breasts, seek medical attention. Don't ignore it. The next myth is that underwire bras and antiperspirants can cause breast cancer. That's actually not the case. Let's start with underwire bras. There's a lot of media attention, at least there was in the past, that wearing an underwire bra can, because it interferes with lymph flow, increase your risk of breast cancer. First of all, it does not interfere with lymph flow, and second of all, there's no relationship with developing breast cancer. The one about antiperspirants, I can dispel that myth. The glands under the armpit that sweat are glands that excrete. They don't ingest anything, and nothing in antiperspirants has been associated with the risk of breast cancer. Many people choose to avoid antiperspirants for other reasons. They don't like the thought of being exposed to any other chemicals, and certainly that's a reasonable thing to consider if you prefer natural products, but there is not a relationship with breast cancer. The third myth is that breast cancer occurs only in women. Breast cancer can also occur in men. More common in people who have an inherited susceptibility to breast cancer, but it's really important to know that men can also get breast cancer. The next myth is that mammograms cause breast cancer. That's actually not the case. We do recommend avoiding X-ray exposure from mammograms if you're under the age of 30. Because the breast tissue is still proliferating in women and men under the age of 30. So trying to avoid exposure to radiation in the very young is probably a good idea. Plus, if you start getting mammograms really young and you get one every year, that's a much longer exposure to radiation in the breast. We generally recommend starting mammography at the age of 40 or over, and depending on your risk level, 45 or even 50 or over. Talk with your medical team about the best time to start screening with mammography. For people who have an inherited susceptibility, the benefit of mammography and MRIs outweighs the potential risk of exposure. So you will work with your medical team if you have an inherited susceptibility, for example, a BRCA1 or BRCA2 mutation, to come up with the right screening program for you. I'm going to be talking about 5 more breast cancer myths. The first myth I want to cover is that there's an epidemic of breast cancer in young women. Although the media, movies, books likes to focus on younger women with breast cancer, most women are diagnosed over the age of 50, which I actually consider young, but breast cancer is typically thought of, and epidemiologic evidence bears this out, that breast cancer becomes more common as we get older. It's just that what the average age of women in the media, in billboards and advertisements, tends to be really young. So breast cancer can occur at any age, but it's more common as we get older. The next myth I want to cover is that trauma to the breast can cause breast cancer. Although I have had patients who had a trauma in the past and then developed breast cancer, there's no evidence that trauma itself can cause breast cancer. The third myth I want to cover is that if you don't have family history of breast cancer, you won't get breast cancer. Although a family history does increase the likelihood that you may develop breast cancer in the future, most of my patients actually have no family history of breast cancer. So just because you have a negative family history doesn't mean that your breast cancer is out of the ordinary. The next thing I want to cover is the relationship between breast cancer and smoking. Unlike lung cancer and head and neck cancer, bladder cancer, and cancer of the stomach, all of which are associated with smoking, breast cancer does not appear to increase with cigarette exposure, except in people who are very young. This information is from large epidemiologic studies where it looks as though if you smoke when you're very young, you may have a higher risk of breast cancer, but not every study has borne that out. The next myth I'd like to cover, and the last one for this video, is that if you are diagnosed with breast cancer, you have to have your breast removed. While many people choose to have a mastectomy or removal of the breast, and for some people a mastectomy is the best treatment to control the disease, mastectomy is actually less often performed than breast-conserving surgery, like lumpectomy. So one does not have to have a mastectomy, and in fact, about 1/3 of women end up having a mastectomy, and 2/3 of women have a lumpectomy in most studies. If mastectomy is recommended, it's because a mastectomy is the best way to keep the disease from coming back in the breast. It does not improve survival in most cases. If a mastectomy is part of your treatment plan, ask your doctor why. What are the characteristics that make this the best treatment option for you? And certainly, some women prefer to have mastectomy, and this generally is how we treat breast cancer in men, is with removal of the breast. It's not necessarily a part of everybody's treatment. Okay, I hope this is helpful. If it is, click like and subscribe. Liking will help other people like you find this video, and subscribing will help you find more videos from our channel. You can drop a comment or a question below. We love to hear about your experience. Our videos are really general information. Your story is your own story, and we always want to acknowledge that. Follow us on Instagram, and if you want to learn more about your treatment options, visit Yerbba.com for your personalized report.